this is Jackie and Renee here at Shift Physical Therapy and Wellness, and welcome to our page. Maybe you found us from Facebook or you're just perusing the website, but these blog articles are ones that we just really open up about all topics that are a little bit challenging to talk about and can sometimes be uncomfortable for people to talk about. So we wanted to provide a safe environment to give you some education and know that you're not alone in these things and that there are people out here that are willing to help you with some of the hard to discuss things. And this topic for this video today is discussing pain with sex. It doesn't always have to be just pain with sex. It might just be pain with inserting a tampon or using some other feminine hygiene products as well. So let's dive into talking about sex essentially.
Yeah, so a lot of times women who are experiencing pelvic pain, even men too, can be troubled by experiencing pain during sexual activity. And it's not something that is often discussed with your doctor, number one, because it's difficult to fit into the time frame, but I think oftentimes people are embarrassed to talk about this topic. And just because something's difficult to talk about doesn't mean that we should just brush it aside. And so as pelvic floor physical therapists, it is important that we talk about sex because it can really have an effect on your well-being if that part of your life is not going well. And I think it's important to note at this point that obviously as pelvic floor physical therapists, we address the physical pain symptoms, but oftentimes this is really intertwined with an emotional component too, because it can cause a lot of stress, strain in relationships, etc. And so I think it's really important to note that you also need to address any emotional stress and well-being aspects with a mental health practitioner if necessary, or maybe it's through some counseling with your partner. But it's definitely something that here at Shift Physical Therapy, we're not going to shy away from the topic just because it's a little bit difficult to talk about sometimes. So I think it's really important to note that we welcome these conversations because it's part of our life, and it's really important that every aspect of your life is addressed through physical therapy.
And the thing about it too is that if you are experiencing pain with sex, we can help with that so that you can enjoy time with your partner, and it doesn't have to be something that you necessarily shy away from, or we can enhance the quality of life that you might have with that aspect of your life if necessary. So when you're with us and we're addressing these questions, know that it can be challenging to even identify what that's like. So we'll navigate that with you, and we'll be asking you some pretty intimate questions, including maybe what positions cause you pain. Is there pain during initial insertion? Is there pain with deep thrusting? Is there vaginal dryness maybe causing some of that pain? So we really get down into discussing some of those topics, and I think it's one of those things that if you know that what questions are coming, then you can avoid that fear of the unknown. I don't know what they're going to ask me. I don't know what to expect. And if we can provide some of that to you and give you some of those questions in advance, it takes some of that fear of even opening up that conversation out of it. And again, we're definitely of that, there's no TMI here. You can't share too much information with us. We want you to know that this is a safe place for you to talk about some of those things.
And we will every time be non-judgmental about any conversation we have, as well as 100% private about these conversations. I think it's important to know that you're in a safe place that you can talk about these things with Jackie or I, and we can help provide some education and provide some help. So physical therapy, pelvic floor physical therapy specifically, we can address any tightness of pelvic floor muscles that might be causing some of your pain. We can also provide you education about some of the anatomy and physiology about the pelvic floor and its function with sexual activity. I think we have a lot to offer in terms of what we can do, even providing suggestions about different positions if necessary, that would be appropriate given your certain condition. So just know that nothing is off limits with
Yeah.
us in terms of discussing these things, because it's all important to your quality of life and how your relationship with your partner may be.
I think it's really important too to understand that it might not just be about pain with sex. This could be something also having secondary symptoms. Maybe you're experiencing low back pain as well, or some tailbone pain. Hip pain is very common. Women who have experienced a history of having a C-section birth have some scar tissue that now all of a sudden is limiting and restricting the function of the pelvic floor and causing some of that pain too. So we're definitely going to look at you big picture and really get a good history to help develop a treatment plan that's going to be most effective for you. So even though pain with sex and talking about sex can be uncomfortable, know that we're here for you. We can help. It's a safe place in any way that you feel comfortable reaching out, whether it be calling us on the phone, stopping in person, or even shooting us a private Facebook message or something like that. Please, please, please reach out and make sure you're doing so with a pelvic floor specialist. That's really important to note, that not just any physical therapy provider, although they're very, very skilled, they might not just have the same background as the specialists here. So we look forward to hearing from you. Don't be afraid to talk about the hard things. It's through those challenges and those hard things that we find solutions that can help you live a better quality of life.